So my name is David Griffith. I'm the Director of Programs and Outreach for the LGBT Elder Initiative. I'm very happy to welcome you to today's Doctors In program, where we will be talking about heart health. So Doctors In, I know many of you have come to programs we've done in the past, but this is a monthly series of health programs that the LGBT Elder Initiative and the Jefferson Department of Family and Community Medicine work on each month to really try to provide information that's going to help members of our communities to have the information that they need to take care of various aspects of their health and their wellness.
So thank you for joining us today. You heard from David what this is about. February is Cardiac Awareness Month, and tomorrow's Valentine's Day, so it only makes sense that we would do a lecture based on heart health. So if you have any questions as we go along, feel free to raise your hand and I'll try my best to answer. All right, so what we're going to cover today, we're going to go over what exactly is the cardiovascular system, how the cardiovascular system changes with normal aging, the signs and symptoms of the most important cardiovascular diseases in older patients, ways to keep your heart healthy, standards for treating a cardiovascular disease, and how to keep a healthy heart. So why is this important? So in the United States and most developed countries, cardiovascular disease, which includes coronary heart disease, stroke, and peripheral artery disease, is the leading cause of death in men and women. So what is the cardiovascular system? It compromises the heart and the circulatory system. So basically the heart pumps blood around your blood vessels, and the blood circulates through a network of vessels through the body to provide all the cells in your body with oxygens and nutrients, and also helps dispose of metabolic wastes. So coronary artery disease is also called coronary heart disease or simply heart disease. So I'm going to be using all those things interchangeably. You might even heard your doctor say all three of those things, but they're more or less exactly the same. And this affects millions of Americans. It's a serious condition and is a result of buildup of plaque in your arteries. So what exactly is heart disease? It's a term given to, and I'm going to say kind of things over and over again because I feel like that's how I learn, but it's a term given to a group of different health conditions that affect the heart. So in the U.S., the most common form of heart disease is coronary artery disease, or I'm going to say CAD. It's often responsible for serious cardiovascular events like heart attacks, heart failure, chest pain, irregular heartbeats, and which is also called arrhythmia. So deaths from CVD. So in 2011, almost 800,000 deaths occurred from CVD, and over 80% of those were in adults over 65. So, and CVD accounted in 2011 for 31% of all deaths in the U.S., so it was the leading cause of deaths in 2011. So clearly it's a very important topic. So the prevalence, so basically this shows that as we get older, the prevalence or the amount of people who have CVD increases. So in people ages 20 to 39, it's around 10-11% of people have cardiovascular disease. And by the time we get to age 80, it's about 85% of men and women have cardiovascular disease. So clearly it's a disease of the elderly population. And it is more in men until around age 80, and then women kind of take over with the heart disease. So age-related changes. So these are some things that happen as we get older to the cardiovascular system. So you have increased arterial stiffness, which makes your systolic blood pressure increase, and that's the number at the top, the two blood pressure numbers. You have a decrease in heart compliance, which means it just doesn't pump or move as well, and you have a decrease in exercise response, and this leads to a decrease in maximal heart rate. So your heart can't really respond as you get up and go as well. So clinical effects of cardiovascular changes. So in healthy older adults, age-related changes have only a modest clinically relevant effect on the cardiac hemodynamic and performance at rest. So basically, as we get older, age really doesn't have too much of, age by itself does not have too much of an effect on your heart rate and how it's functioning at rest. So if you have like a 20-year-old and an 80-year-old, if they both have a healthy heart, then they actually perform the exact same. So the resting heart rate, ejection fraction, stroke volume, all those good things are actually preserved at a very advanced age. It's only those things surrounded, the comorbidities surrounding those, that actually cause you to have the heart failure and the disease. So though heart disease risks do increase with age, it doesn't have to be an inevitable part of getting older. So that's kind of why we're sitting here now. The right lifestyle habits, regular doctor visits, and a heart-healthy diet can help protect you. So, what are some of those things? So this is the bulk of the presentation. We'll go over 7 steps to help you prevent heart disease. So 1 through 7, we're going to get exercise, quit smoking, eat a heart-healthy diet, watch your numbers, reduce your alcohol intake, minimize stress in your life, and watch your weight. So if you can do those 7 things, we should be able to keep your heart nice and strong. So get enough exercise. This means get at least 30 minutes of exercise 5 to 7 days out of the week. So we want to make sure your heart rate gets up and is pumping. Basically, you don't necessarily have to sweat. You don't have to pass out. You can keep a moderate pace and be able to talk to your friend next to you, but 30 minutes of something helps keep you good. So low levels of physical activity are associated with increased risk of cardiovascular diseases and all-cause mortality in people of all ages. So, just sitting there watching TV all day long is not going to help you be healthy. Of course, quit smoking. We all know in here that smoking clearly is not healthy. So if you do smoke, it's time to quit. Your PCP can help you with that. So prevalence of smoking actually declines with age, and it's probably due to 2 things. Successful smoking cessation. So of course, as you go along in age, it's more likely that you're going to quit. And also, you probably have less people who are older who smoke because they die at young ages anyway. So among older smokers, smoking cessation is associated with substantial reductions in cardiovascular disease risk within 2 to 6 years relative to continued smoking. So basically, if you quit smoking in like 2 to 6 years, your heart and your cardiovascular disease risk will actually look like those of someone who did not smoke. Number 3, eat a heart-healthy diet. So if you individuals who eat heart-healthy diets have a lower risk of cardiovascular disease, and this includes coronary heart disease and stroke. So heart-healthy diet, these things include fruits and veggies, fibers, including cereals, foods with a low glycemic index and low glycemic load, so low sugars, monosaturated fat rather than trans fat acids or saturated fats, and omega-3 fatty acids. Yes? She asked if those things included avocado oils and avocados, and yes, that kind of goes in the whole monosaturated fat rather than trans. Any other questions? Okay. So omega-3 fatty acids, so these are things from like fish, plant sources, or supplements for those who might not eat fish because you might be a vegan or vegetarian. So number 4, watch your numbers. So always get regular checkups to monitor your health conditions that affect your heart. So these include blood pressure, high cholesterol, and diabetes, and make sure they're under control with like medication, lifestyle changes, or whatever your primary care doctor tells you to do. So like high blood pressure, increased systolic blood pressure was identified as the strongest risk factor for incident cardiovascular disease in older adults, including those over age 80. Diabetes. Prevalence increases with age up to age 80, and then approximately 50% of those people with diabetes are actually 65 and older. So as in younger patients, diabetes on CVD is greater in women versus men. So women are at higher risk. Cholesterol, so a little bit about LDL versus HDL. We kind of hear which one's the good, which one's the bad, so I just wanted to review that. So basically, cholesterol just travels through the blood on proteins called lipoproteins. There are 2 types of lipoproteins, LDL and HDL. LDL, or low-density lipoprotein, is the bad cholesterol, and that's actually what makes up the most of the cholesterol in your body. High levels of LDL can raise your risk for heart disease and stroke. HDL is the good cholesterol. That's the high-density lipoprotein, and it actually absorbs cholesterol and carries it back to the liver. The liver kind of flushes it out, filters it out from the body, and high levels of HDL can actually protect you from heart disease and stroke. So high cholesterol, the strength and association between total cholesterol and LDL actually decreases with age, especially after age 80, and clinical trials have demonstrated benefits for statin therapy. So your doctor might put you on like a medication like atorvastatin or statins to help lower your cholesterol. So 7 steps. Number 5, reduce your alcohol intake. Excess alcohol consumption can worsen your health conditions. It can increase your blood pressure, increase your chance of having an arrhythmia, and increase your cholesterol level. So that in itself makes it not good. No, so number one word right there is excess alcohol. So alcohol in excess, and we'll actually go, the next slide kind of shows like how much you should have. Men typically are larger than women, more or less sometimes, but in general, the CDC says that men can drink a little more alcohol than women. So men should not exceed 3 to 4 units a day or 24 units a week, and women should not have more than 2 to 3 units a day or 14 units a week. And this is like daily. Of course, if you binge drink or do all this in one day, that doesn't mean that you're, it's still really bad. You don't meet the guideline if you do 21 drinks in one day. So basically 1 unit, a half of a glass of wine is actually 1 unit, or a half a pint of beer, or 1 measure. It's like basically most of the shot glasses in the US are actually double of what a unit would be, but a half a glass basically of, a half a shot glass of, we call it spirits, would be 1 unit. So yeah. Right. Just depends. I mean, sometimes we'll get a bigger glass, so it's hard to say, but 175 milliliters will be, half of that would be your unit. Yeah, which is really small. Yeah.
Is it better to drink wine with food because it's absorbed as opposed to, say, drinking by itself?
I honestly think it would be about the same. You might have like the effects of you feeling a little tipsy, be kind of altered if you eat or not eat. Oh yeah, he asked if food with wine will help you will help with these guidelines basically, or make it any better or worse. Yeah. Other than that, some other things like half a bottle of wine contains 5 units, and I know a lot of times you can sit down and literally you and your friends, 2 of you drank a bottle of wine and it's like, oh, that was, yeah, but yeah, that's actually 5 units, so you went over your daily intake. A strong pint of ale contains 3 units, and a strong pint of cider has 5 units. And again, we only want to do 3 to 4 a day for men and 2 to 3 for women. And a cocktail can contain as much as 5 units, so that, yeah, a little cocktail can do that. Of course, pregnant women, we advise you not to drink, but if you do, try not to have more than 2 units twice a week. I actually don't know what sherry trifle is, but evidently it has some alcohol in it. Yeah, so we're gonna, yeah, that's it. Number 6, minimizes stress in your life. Easier said than done, but stress can compound many heart disease risks that people already face, so that can in itself steer you away from a healthy lifestyle just from having stress. When we stress eat, binge drink, that can do that. So finding healthy outlets to relieve the stress will help lower your risk of heart disease. And number 7, watch your weight. So too many pounds can add up to increased heart disease risk. So to help you prevent a heart disease, maintain a healthy body weight for your size, you can talk to your doctor about that. Definitely we like to keep you under 28 BMI, but if you go between 30 and 35, it just depends. You have to talk to your doctor about that. So just to reiterate, many health conditions can contribute to heart disease and increase your risk of having a heart attack. There are many treatments that you can do. So basically, we should lower our blood pressure and cholesterol, keep diabetes under control, and take the medication to treat any kind of chest pain or any kind of symptoms that you might have. So there are different types. People might say they had a heart attack or a myocardial infarction, but in the medical side, there are different ways that we categorize these, and we put them under the big umbrella of acute coronary syndrome. So they include unstable angina, non-ST elevation MIs, or MSTEMI, or ST elevation MI. So unstable angina and NSTEMIs are considered together because they're kind of the same pathophysiologically, and they're kind of clinically difficult to distinguish. So basically, when you come to the ED, you have this chest pain or other symptoms. The only thing that can distinguish these would be like biomarkers like troponins and the EKG, the little thing that they strap you up with, and you get the little boop, boop, boop. Those would be the things that we kind of distinguish, and based on that, you'll have different treatments. But we won't go into those. So the arteries, they start out smooth and elastic, and then based on your health status, the cholesterol, they get plaques in them, and that can make them more rigid and narrow. And this restricts the blood flow to your heart muscles. and this is what leads to the heart attack. So basically, death of those different areas within the heart, and it damages the heart because it's starved of oxygen, because we said earlier, the blood supplies the oxygen and nutrients to the heart. And then the plaque could also rupture, leading to the heart attack or cardiac death, and that's when you get the pain and the symptoms. So warning signs, sometimes they don't appear until you're having a heart attack, until it's that serious. So some of those symptoms might include feeling faint, weakness, or lightheaded, having a hard time catching your breath, feeling nauseous vomiting, having indigestion, pain in your chest or pressure. Sometimes they say it feels like an elephant sitting on my chest. The pains can radiate to like your back or your neck or your shoulders, your arm, or you can have an irregular heartbeat. So that's when you go, oh no, I need to go see my doctor or call 911. And it also can differ depending on your age. So after age 80, the chest pain, the whole elephant sitting on my chest might not be the case, especially if you're dealing with friend, mom, dad, grandparent with altered mental status or dementia or something. They might not be able to say like, hey, my chest is hurting. So they can actually, shortness of breath is the most common symptom in patients between 80 and 85. Mm-hmm.
Question on that, the shortness of breath for patients between 80 and 85. So I'm 65 and I get shortness of breath all the time. Is that something I should worry about?
If you get shortness of breath all the time,
like if I try to run to catch the bus or the train or something, and then I'm like,
I would say I wouldn't, like a heart attack would not be very high on my differential, but it could mean that you could have other cardiac issues. And of course, this is like really general. You have to have a lot more questions answered between your PCP and your cardiac doctor. But this is why you kind of have to follow up with your primary care doctor, because your heart, your lungs, and everything else in your body is kind of all related. It is all related. So you might have the shorter breath because of asthma. You might have it because of your heart. You might have it because, the high blood pressure. It could be a lot of things that could be going on. Yeah. But if it's something like super sudden, super serious, that's when you want to say, okay, this is different from the norm. That's when you really want to call. But if it's something chronic, it wouldn't be a heart attack.
To follow up on that, so I'm thinking of environmental factors, that, particularly with the lungs, I'm thinking how unhealthy the air, how that could also cause kind of a shortness of breath. You mentioned asthma, which I guess was that. So in other words, you should look at what the environmental factors in breathing in the city.
Correct.
And urban areas. Is that?
Yeah, it definitely would affect shortness of breath. But again, it would be more of that like sudden shortness of breath. Like if you say you're running and then you get shortness of breath and then it stops, or if you're outside, or even if you're 85, I don't know if asthma, if it just like randomly starts, like you would probably had a history of asthma or COP or something that would make me want to give you medication for that. But if this is something like changing from the norm, that's when I would get worried and say, okay, maybe we need to look at other organs other than the lungs. And then older acute coronary syndrome patients, they're also more likely to present with altered mental status, confusion, dizziness, or they might just pass out, which is syncope. She said that the presentation can also differ between men and women. She said that men often have it in the left arms, or women will have the pain in the left and right arm. I didn't read that. Maybe, have y'all heard? Yeah, okay.
I think some women can have different symptoms, not necessarily the classic symptoms. And I think kind of getting it back to what Dr. Reeves was saying is that sometimes in older adults too, it's not as like the typical what you see on TV. It can come in different ways. So that's why whenever somebody's feeling off, to think maybe there's a heart attack going on.
But the number one, I think we say, if it's a change in the baseline, that's when because if someone is demented and has altered mental status at baseline, I wouldn't necessarily worry too much right then and there about a heart attack. But if they seem more demented or confused, or they weren't, and then they have altered mental status, that's when that would be in our differential. Any other questions? Yeah.
The last word, syncope?
Syncope, yeah, it just means basically passing out. Yeah. All right, so some epidemiology work. So mortality after acute myocardial infarction or heart attack increases with age. So basically, as you get older, the chances of you dying from MI actually increases. And the prevalence of clinical CAD increases with age also in men and women. And 2/3 of all MIs occur in adults over age 65. So the 65 and older age, our geriatric age group is at a really big increased risk for having a heart attack. So of course there are medications that can help treat the various aspects of heart disease. So to manage your different symptoms such as your chest pain, you might get one. You can get nitrates, beta blockers, calcium channel blockers. There are many different classes of drugs that we're not going to go into, but you might have heard of some of them. So your doctor may also suggest taking a daily aspirin to help reduce the risk of a heart attack. All right, so other therapy options other than just medication therapy are revascularization, PCI, which is non-surgical. Revascularization is surgical. This one, they just take a wire and kind of make it wider, make your arteries wider so that you can have the blood flow through. Or bypass surgery, which is when they take an actual vein or artery and then attach it to your heart to kind of bypass one area that doesn't have blood flow to another area that does, to kind of help with the flow there. That's a surgical one. So out of the three, revascularization and bypass surgery are surgical, whereas PCI is non-surgical. So you might do that in addition to the medication management, but clearly that wouldn't be the primary care doctor or the geriatrician. Would be more the surgeon, the cardiovascular surgeon, the radiologist. All right, so in summary, aging is associated with extensive changes throughout the cardiovascular system. We went over those 7 steps to help prevent those changes, so follow those. Older adults account for the majority of the patients hospitalized with acute coronary syndrome, and 80% of deaths are attributed to ACS occurring patients over 65 and older. Although the benefits of current treatments for ACS are generally similar in older and younger patients, older adults are at increased risk for complications. And if your loved one suffers from cardiac issues, there are many medications and procedures that can help you or them, even after you get there, just in case the 7 steps don't work out completely for us. So that's it. Thank you for listening and participating. Those are the references, and y'all have any questions that we were asking as we were going on?
So someone expects that they might be either experiencing shortness of breath or chest pain. They call 911. You kind of talk through what happens. What happens then? Like what's the medical professional going to do to someone who expects that?
Yeah, so if you call 911, EMS will get there, it take you to the ED, then they're going to give you some aspirin. They normally give you like 4 baby aspirin. They're going to put you on some oxygen. They'll ask about the timing. They'll get an EKG to kind of see like what your heart looks like, to see if it is that in-STEMI versus a STEMI. You'll get some blood work done to check some of those biomarkers like the troponins and things. And if that's super high, they might call the cardiologist, and they might whisk you away and get the surgery or the PCI or whatever procedure you might need. If they see that the troponins or the EKG actually looks fine, they might just watch you for like 24 hours and give you some medication to help with the pain. Also, they give you a nitrate to kind of help open up the blood flow too. And yeah, that's it more or less.
I think one of the things is that sometimes people have medications that are given to them by their doctors for chest pain. I think it's important that if you're having this, when you call 911 or you have a doctor that you tell them that you're somebody that has cardiac disease, if you have chest pain and you have those pills that a doctor gave you for chest pain, that you take them before you see the 911 people.
Because it will be time before you get there. Yeah, if the symptoms show up, I wouldn't try to give them anything like over-the-counter, because some over-the-counter medications that are for pain wouldn't really help them in that situation. So I think that's when you would just not play doctor and just call 911 and see, let the professionals handle it. But let them know, of course, that they do have an allergy to aspirin.
prone to risk, or which groups of people are prone to risk for being prescribed that statin or, for that type of medication?
Yeah, I guess when that, so he asked like what group of people are at risk for needing statins? So basically, if you have high cholesterol, that's when we want to start you on a statin. And we check your cholesterol. Normally you get your cholesterol checked like every year. Of course, if you have other disease processes or I don't want to say you're unhealthy, but you might be obese, like that might predispose you to have higher cholesterol levels. Or after like a heart attack, even if your cholesterol levels aren't very high, your doctor might still start you on cholesterol lowering medications just to help prevent future.
Once you're taking high blood pressure meds, how can you get off of them if you wanted to?
Yeah.
Do you have to go back to the doctor and have them take you off of it, or
Yeah.
you can't just stop it?
Yeah, I wouldn't just stop it yourself, just because sometimes you might see that your blood pressure, it looks good, but it's good actually because you're on the medication. If you are overweight and you're not eating well, and then you actually like go out and do the exercise in 30 minutes a day and do those things, it is possible to get your blood pressure lower that way. Also, just with some physiologic changes in your body, sometimes some people go up, but sometimes some older people actually go down in their heart rate and their blood pressure. So it's also possible like that some people have been on blood pressure medicines for 10, 15 years, and then all of a sudden their blood pressure starts to lower. So the doctor might slowly take them away that way. Also, after a heart attack, your doctor would put you on a certain amount of medication, just as standard therapy, and sometimes those medications are only used for like 2 or 3 years, such as like a beta blocker, so he might also take that away based on the amount of time. But if you're doing well, your blood pressure's good, your heart rate's good, then it might just be something that's going to be for the rest of your life. But it's just something you just have to follow up with your primary care doctor and your cardiologist to kind of see. But it is possible to get off of those medications. Yeah, she asked if a person is unwilling to take any medications and they have like high cholesterol or diabetes or high blood pressure, how can they kind of get those levels down and how long it would take to do such? I think it depends on each person. Like say she was on last week's episode of My 600-Pound Life versus if she is, an athlete who's a type 1 diabetic. I doubt she would have made it very long without diabetic meds. But it just depends on each person. But each person can do those lifestyle changes if they are completely unwilling to do any kind of medication. So just make sure they eat healthy, like that diabetic person should cut down on those carbohydrates and on the alcohol, because that does have sugar and carbs in it too. They have to cut down on the sugars, and if they're hardcore about it and she loses all the weight and does the things she could, it's possible that she could stop the progression of the diabetes and high cholesterol and all that stuff if she was hardcore about it. But again, that would be up to her. Mm-hmm. Mm-hmm. Yeah. So to get more of a personal plan, I would definitely say visit your primary care doctor, because of course all these are super general. We're talking to people who are 50, who are 80, who have different past medical histories as far as their family and social histories and things. So I mean, what I tell you, you might need to stop smoking and someone else needs to stop drinking. So all that kind of comes into play. But I would say in general, stick to those like 7 healthy tips. Like you want to eat well, you want to exercise. Make sure that if you do have any medication or medical concerns that you actually take your medication as prescribed, no matter what. And I mean, if you do that, that's kind of honestly what you have to do. Of course, this coming here is a first step in getting educated, but it's up to you guys to kind of take these things and apply it to your life and help out, your community members and your family members.
I want to clarify the thing about smoking.
Mhm.
Primarily talking about tobacco.
Yes.
Just, is there any connection, smoking marijuana, anything to do with the negative things in terms of heart attack? Primarily
Yeah.
smoking, talking about tobacco.
Mm-hmm. Yeah.
But not marijuana. Is there any that you've seen or heard of any kind
I've
of-
heard of a couple just because there is smoke with marijuana, and of course that's not good for your lungs. Of course, there's like other ways to ingest cannabis other than smoke, but the most common way is smoking it. So I don't know exactly how that affects like cardiovascular. So the question was about marijuana smoke and versus tobacco and how that affects the cardiac and pulmonary systems.
It's pretty much the same risk for cigarette smoking as it is for smoking marijuana. Now, someone who smokes cigarettes is probably going to smoke more cigarettes than they will marijuana per day, typically. But it's still not the safest way. There's other ways to, as you were saying, actually take marijuana. There's food products, tinctures, oils, which is worth
Vapeless.
considering.
The
But
vape.
medical marijuana.
Medical marijuana, yeah.
Because
Yeah.
Like say if I'm signed up to get
Yeah.
marijuana for glaucoma.
Yeah.
Mhm.
Okay. Got
At
it.
the places, they have all those different
Yeah.
things that you can get. So it's definitely safer.
But still see a doctor for medical marijuana.
Yeah. Do you have any more questions?
I have a branch block.
Mhm.
Doctors have done EKGs on me for like 30 years.
Mhm.
Nobody's ever really explained it to me. They usually do the EKG and then they leave the room for to get an explanation.
Mhm.
Is it a murmur?
So I wouldn't consider that a murmur because that's more about how the blood flows. A branch block just means that you have a little blockage at one of the little points, like right there. Normally you'll have symptoms if the clot is in like a bigger area and cuts off blood supplies to a part of the heart, like, and it affects like 5% or more of the heart, or it makes that part of the heart like die. But as far as like yours might be something super small, and because you're not having symptoms, you're able to walk, talk, act the same. They're like, there's no need for us to put this man through surgery, put him on a bunch of meds when he clearly is fine. We'll just kind of watch it. Almost like if you had like a growth on your arm, you're like, is this cancer? And then you go to the dermatologist and they're like, I don't know, is it growing? No, it's been there for 30 years. Well, we'll watch it. If it starts to grow and act funky, then we'll cut it off. But if it ain't broke, don't fix it.
So it's not rerouted something. The branch is just blocked.
It's kind of just blocked, yeah. But there are other branches, that's why it's called a branch, and other arteries and veins going off to that area to supply that area, that muscle of the heart. So even if that one little branch is kind of blocked off, you still have other branches of blood that can supply the nutrients and everything, which is why you're probably not having symptoms. So they're saying there's no need for us to put you through this major surgery, put this wire through you to help unblock this when you already are fine. Yeah, so it's fine.
We also talked going back a couple months when we did the stroke presentation. Can you just talk a little bit about sort of any links that might be around between something being wrong with your heart? I remember we talked about different types of stroke. So I'm saying how to kind of connect it with that. So can you just talk a little bit about sort of heart health?
Yeah,
and
so
sort of
basically you have blood flow to your brain, you have blood flow to your heart. It's kind of more or less all related. Of course, the heart's going to pump blood to your brain. It's going to go down. So if you have like a part of your brain that doesn't receive blood, you're going to have a stroke. If you have a part of your heart that doesn't receive blood, you're going to have a heart attack. So that's kind of how they're the same. Well, thank y'all for your participation. It was really good. So that's it.
Before you're dismissed, does anyone want to try to give the Dr. Reeves 7 tips for heart health? Some of you were taking notes. It could be a group effort. Greg.
Eat healthy,
Eat healthy.
exercise, go see my doctor.
Okay. 7.5. Okay.
We're doing eight tips.
One was you said you didn't do. Mm-hmm.
Drinking, stop, control.
Alcohol.
Drinking,
Mm-hmm.
stress, avoid stress.
Yes.
Exercise.
Lose weight, exercise. Yeah.
Like you said, exercise, lose weight,
Okay.
work out, I can
Okay.
work out.
Just a small shirt.
Watch your numbers.
Watch your numbers. Thank you. That was
Proud.
Thank y'all.
Cool. So thank you again to Dr. Reeves for being here. Before folks leave, again, check out some of the resources on the back table. There's lots of more information on some of the stuff that we were talking about today.